Hello everyone. This presentation is on Xiang Tang, also called Costus root and Amomum 6 gentleman decoction. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Xiang Tang belongs to the category Tonify Kai. A representative pattern is spleen Kai deficiency with damp and Kai stagnation causing bloating, belching, and poor appetite. Important ingredients include Ren Shen, Baizhu, Fu Ling, Gan Kao, Ban Zia, Chen Pai, Mu Xiang, Sha Ren. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 49-year-old man with post-meal fullness and chronic functional dyspepsia. The current medicines are metformin, sertraline, hydrochlorothiazide. This case gives a possible reason to consider Xiang Tang, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Ren Shen plus metformin. The mechanism is that ginseng may augment glucose lowering. The clinical significance is moderate. My management plan is monitor glucose, especially early in treatment. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Gan Kao plus hydrochlorothiazide. The mechanism is that licorice may lower potassium and raise blood pressure. The clinical significance is moderate. My management plan is monitor blood pressure and potassium. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Mu Xiang/Sha Ren plus oral medicines. The mechanism is that aromatic digestive herbs may alter GI motility and tolerance. The clinical significance is low. My management plan is separate important oral medicines by 1 to 2 hours, if needed. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Xiang Tang may be reasonable when the patient truly matches the pattern spleen Kai deficiency with damp and Kai stagnation causing bloating, belching, and poor appetite. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.